we have had a very engaged audience the whole time, and now we have 52 questions. A lot of them are very granular, so I am going to represent the audience and ask a couple more general questions. One is to Professor Zhang. Given what you know of the situation in the US, what is your impression and what is your advice on how we should manage this pandemic in this country? And maybe Dean could comment on that as well.
Okay, I think actually the increasing cases in the United States beyond my expectation at the firstly. In the very early stage, I think the confirmed cases will not increase so quickly in the United States because I think the United States has taken the strict measures, just like the shutdown in New York and have the very broadly detection for the disease around the country. But later, maybe according to my information from the United States, I noticed that before the March 8th, that the detection was not taken so broadly. I compared the data with the United States and China. We can find that the first case entered Shanghai is January 21, but the first case entered the United States is January 20, so almost the same day. But after the 2 months, in China, in our one province, just like the Guangdong province, we can find that in 1 million population, they can do almost 3,000 tests. However, in the United States, before March 8th, I found the data is per 1 million capital, the detection data is 5. So I think before the first 2 months, maybe there's something wrong in the United States that they do not do the very enough detection for that. However, I think different countries can take a different strategy. So therefore, I can see that there's the increasing case increased very fastly in the United States. But after the March, I think today now after the whole March and also in the April, I saw that there's a great development, lots of detection method now was done in the United States. We can see that the capability of the detection now is very, very good. And I noticed that there's a lots of detection technique now was done in the United States. So therefore, I noticed that the peak of the emerging new cases now the breaker point now emerged. So therefore, I think in the near future, in the following 2 months or 1 month, the confirmed cases will be keep very stable in the United States, and I think the United States will control the disease in the end, maybe after several months. So therefore, what I major concern is not United States. It may be, I think, in the South America, it's a major problem. So that is what my thinking about the situation in America. Yeah.
Professor Zhang is very well informed, and I think we can go on to the next question.
Yeah. How about the heterogeneity of how the disease presents and is managed in different parts of the United States? How do you explain the difference between New York situation versus Washington State and San Francisco? And what are the lessons that we can learn from that?
I don't think we should underestimate just how crowded New York City is. There are almost 2.5 million people just on the island of Manhattan. we have very few streets that are as wide as the boulevards of Beijing or Wuhan. It's a crowded city. It's a vertical city. The lowest proportion of adults with driver's licenses are in New York City compared to anywhere else. They take public transportation at very high levels in that city. So we have a lot of crowding. Those of you who've been to New York City know exactly what I'm talking about. You feel like you're in Tokyo. You feel like you're in a crowded part of Shanghai. It's one of the world's mega cities. So if you introduce virus, it can spread very quickly. And New York City did not shut down as quickly as it should have in 2020 hindsight. San Francisco was much more aggressive. Seattle was much more aggressive. So we are a funny country where we're a federal system. And as all of you know, with your Yale connections, there's considerable responsibility and authority that's reserved at the state level, not at the federal level. So states can often do what they want. And the primary responsibility for public health response is the state. The CDC is advisory. CDC has very little state control. So some governors said, oh, we think this is important, we should respond aggressively, like Governor Inslee in Washington State and Governor Newsom in California. Later on, Governor Cuomo in New York. Other governors have not even got stay-at-home recommendation. I think there are still 7 states that have no stay-at-home recommendation. They're more rural states and they're more Republican states, and the governors are more relaxed about it. So one is concerned that the epidemic will wash over those states at a later date. Now, maybe the travel restrictions have helped and perhaps they will be spared, but you know, there's such heterogeneity, and a big difference between China, I think, and the US is no, you didn't really ask this question, but I'm going to answer it anyway. I think the cultural differences. China has more of an authoritarian tradition, all the way back to Confucius theory and to warlords and to emperors and to the Communist Party. The US, more libertarian tradition. You're not going to tell me what to do. The government's not going to tell me what to do. I'm going to do what I want. So this balance between individual liberty, as we sometimes call it, versus social responsibility. It's like, you know, social responsibility in Europe, a little bit higher than the US. Social responsibility in China, even higher than Europe. You see what I mean? So when we have a pandemic, having a little bit of authoritarianism is not necessarily a bad thing, where you control the pandemic. And that's not our tradition. So it's taken us a long time to get there, and that's why I think we have the worst epidemic in the world.
Yeah, maybe we'll do a last question. How about vaccine to both of you? When do you expect we'll have an effective vaccine? And even before that, how about antibody testing? Do we know that is going to be helpful in managing this pandemic? Does that imply immunity? There's, I guess, 3 questions in there. Maybe start with Professor Zhang.
Okay. For the vaccine, I noticed that recently the vaccine team from China and from United States NIH team, actually they started the phase 1 study, and also they got some great data in the animal model. However, before the vaccine launched, I think there's a lot of work to do for the safety of the vaccine, and also I think the protective efficacy for the vaccine still remains to be answered. So according to my experience in the vaccine, I think recently the vaccine, most of them are just the DNA vaccine or the high level vaccine, I think maybe the efficacy cannot be certain in the eventually. So therefore, I think at least we need 1 or 2 years that we can got the vaccine. Therefore, before that, the immunity in the population is very important. But according to my calculation, I think if the people in the United States or China got the immunity in the whole population, almost 2/3 of the people will infect the virus. However, if we have 2/3 of the population infected the virus, almost several million people in the United States, and I think almost 10 million people in China will be, I think, will be dead, will be caused by the disease. So I cannot accept that. So therefore, because the mortality for this disease is almost 10 to 20 times that in flu. So I think we have to take the strict measures for this disease to mitigate the disease, and also we can stop the spread of the disease among the aged population. I think is very important. So recently, the greater concern is about in the India, South America, and also in Africa. I noticed that there's outbreak in these countries. So actually, in the future, I'm still very concerned about in the following several 2 years. However, I still have the hope, just like the professor mentioned that, just like the flu, I think after I wonder if we still have the hope that after the summer, we will stop the spread of the disease around the world. Actually, professor is a very famous public health expert. I want, if I can get some evidence for this disease around the world, stop the spread in the world just because of climate change. So I want to hear what his comments about the disease.
Sten?
Yes, I guess these are my final comments. Let me say that when I was a boy in the 1950s, there were 2.4 billion people on Earth. When I was born, 1954. There are now 7.7 billion people on Earth. There will be close to 10 billion people in less than 20 years.
Yes.
So we pressure our wild spaces. We cut down the Amazon. We cut down the Burmese rainforests. We bring humans closer and closer to animal populations. And when you look at the number of pathogens that have entered human beings from vertebrate animals, the zoonotic diseases, you're seeing a steady drumbeat of these things coming into humans. Coronavirus is the most recent. Coronaviruses are endemic in bats. There are over 200 species, and there are only 3 that have infected humans at a very high pathogenic level. How many others are there that could come into humans? And they're the hantaviruses. I mean, there's so many organisms that are coming into human beings as a consequence of this new world that we're living in. We've been undisciplined, with the exception of China, in offering family planning and contraception for women who want it. We've not met the unmet need. We are reducing species diversity because of our global warming lack of commitment. The 2 worst polluters on the planet Earth are the US and China. They're the 2 worst. So we just have to look in the mirror. And we're contributing to global warming far beyond what we should be. We have the technologies for renewable energy. So we're reducing species diversity. We're increasing the human population. We're chopping down our rainforests. We're polluting our oceans. I think that there's a direct link between coronavirus and the global warming and overpopulation circumstances of our globe. And I think we're going to see more and more. So number 1, we have to take population seriously. Number 2, we have to take global warming seriously. Number 3, we have to take pandemic preparedness seriously. And if any good comes out of this human catastrophe and this economic catastrophe, then it ought to be a recommitment to those 3 goals. And thank you to the Yale Alumni Association in general and our beloved Yale Healthcare Club in China in specific for making this possible. And I want to really thank Professor Zhang. I was so impressed with his presentation. I'm so impressed with the work that he's doing. And I thank him on behalf not only of the people of China, but the people of America, the people of the world, for the work that he's doing to take these early lessons from China and bring them to all of us. So thank you very much.
Great. Thank you. Thank you very much, Dean Vermund. You stole the words from me. Yes, we thank Professor Zhang for taking time from your very, very busy schedule to share your experience for all that you've done for the world. In terms of follow-up, we will be sharing the recording of this webinar. We will keep these questions and try to get them answered by our experts. And for future events, look at the Yale Alumni event calendar, join our Facebook group so that you can share more of your thoughts. Thank you very much, everyone. And Kevin, do you have other lasting words? Great. Thank you very much. Goodbye.